Welcome to SkinSide Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to SkinSide Out, where science meets beauty. I'm your host, Dr. Zain, with Heather, Courtney, and Crystal. Today, we're talking all about body contouring. So let's get right into it.
I think this will be an interesting topic with all of the GLP-1s, coming into play. I feel like a lot of these non-invasive technologies were, before GLP-1s. Yeah. And so now they've kind of taken over from some of these.
Yeah, I mean, honestly, I feel like med spas aren't really investing in these technologies anymore. And the ones that have in the past are just sitting with dust collecting on these devices. So I'm so glad I did not invest in this.
I think first and foremost, everyone knows CoolSculpting. It's probably the most popular, non-invasive body fat treatment that I think everyone's heard of. So CoolSculpting is, basically freezing the fat. And it is a procedure where they will take these like planks essentially and place them on abdomen, legs, arms, underneath the jaw area, and let that sit. And it freezes so much at such a high temperature that it's essentially freezing the fat without damaging the skin. So it's incredibly painful. Me and Dr. Zain can both vouch for that.
Yeah, I almost passed out.
That
massage.
Yeah, they will do a massage after where once the planks come off, they'll massage that whole area. I think it's like for 10 minutes or something. And it was the most nauseating feeling that I've ever experienced. And I've broken my arm 4 times. So I feel like that's saying something. And I feel like it didn't do anything. And it also took a long time for me to get like those like nerve endings back. I don't know if you had that feeling too. Yeah, the numbness took a long time to wear off. But I'm not a huge fan.
Yeah.
I think there's still risks too. I mean, there's the risk of destroying the skin or harming the skin. I've seen that before where it's not quite targeting the fat as well as it should.
And the paradoxical adipose hyperplasia there's been lawsuits on that where
and it's more common than you think.
Yeah, and that's where it's doing the opposite of what it's intended, where it's creating more fat. So, obviously no one wants that.
Who was that model that had it like last year? And she really went on social and letting people know.
I didn't know who she was.
Yeah, because she did the jaw area.
Yeah, and she said she had like the fattening effect too.
Yeah, and it's like, I mean, it's not covered by insurance. It's obviously cosmetic. Yeah. And so investing a lot of that money and not really getting the result or even getting a worse result.
Yeah, I mean, I think the concept is really cool. Rox Anderson, who's a rock star in the dermatology world, he's the father of many of the lasers that we have today. He thought of this concept of freezing fat and using it for aesthetic applications for body contouring. So in theory, it's a pretty cool concept. However, in practice, I find that the results are disappointing. You really have to be selective about the right patient, and even so with that, a minimal result. So I really do think that, for something that costs thousands of dollars, multiple cycles, and you also have to make sure that you keep up with your nutrition. You can't be eating like crap all the time and expecting for those results to last. So I just feel like it's a waste of money.
Yeah, I 100% agree. I did not see, I think, any difference. And I know you are supposed to have a few sessions, but I think the pain was so unbearable for me that I could not stomach another session.
And I will totally agree with you. That was one of the most painful experiences I've had. But that's not the norm. There's a lot of patients who have absolutely no pain with this procedure. But I just don't think it's effective.
Yeah, and there can be some, candidates that are not, people who have like the cold urticaria where, because it is freezing that area. So if you're having like hives essentially from, coldness, you definitely want to do it. People who have like Raynaud's, I'm sure, certain conditions that I think would probably disqualify people from being an ideal candidate.
And if they ever had like other surgical procedures, their
Scarring,
tissue,
yeah.
prior liposuction too, like that's not normal skin anymore. So you have to be careful about that.
Yeah.
So I guess we're all pretty unanimous. I mean, Crystal, have you experienced CoolSculpting?
I haven't, and I don't like the way it looks. It looks super painful. I'm good.
Yeah. At your former med spa, did you guys offer that?
We did, but there were so many complaints and issues that they actually got rid of it altogether.
Oh.
Yeah, at my previous practice, they got rid of it. In fact, that's why I got my plan. They were free, and we were actually like trying to get people in to do it, and we couldn't get anyone.
Wow.
So it lost a lot of money on it.
So cryolipolysis obviously is probably one of the most well-known treatments for body contouring, but there are a lot of other technologies on the market now. And like CoolSculpting, I don't think that they're great. They're no slam dunks. So we're looking at devices that use laser light therapy, that use radiofrequency, ultrasound, and I feel like, you can get some good results. They're not, very long lasting. And we may actually see, patients who, after a couple of years with an aging process, I mean, it's really not working as effective anymore because, we're hoping that collagen production and, that fat loss will be the same, but we're also aging at the same time.
Yeah, and I think they've been marketed for so long as truly like to treat fat, but in my experience, I find it more to be that it really is like a body contouring treatment. Like you're not going to have someone who has too high of a BMI come in and treat them. The candidates for a lot of these procedures, you really have to meet certain qualifications. And again, it's not going to be this overnight change. It's usually very subtle and very, particular, I guess.
Yeah, it's best for if you just have like a little bit of like a love handle that you wanna, or like a little muffin top that you wanna try to minimize.
Like me, I'm pretty thin, and I've done it before, and I feel like it just almost gave the effect of losing a little bit of water weight, but nothing had really changed. And every time you go back, they measure you, and they would half measured me. Like in the beginning, they did it really loose. Yeah, and then they got really tight each time. But
Shady.
Yeah, exactly.
Wow.
And I did several treatments, so no change.
I mean, there are some, technologies that do have some merit, though. I mean, I feel like Courtney was saying, though, it's more body contouring than fat reduction. And I know that, some people, are doing localized injections of Kybella deoxycholic acid for targeted areas and have had success, but I think it's for really small areas. And, like the other treatments, it may take multiple treatments and minimal results sometimes.
Yeah, well, and it's important to keep in mind a lot of these are treating the subcutaneous fat and not like that deeper fat. So again, if you're not living like a healthy lifestyle, you have that visceral fat like around your organs, and that's not going to treat that. That's, coming from exercise, eating well, those types of, methods. So it really isn't, again, like the targeted obesity, treatment.
And I think sometimes people mistaken fat for loose skin. Like it will give the appearance that it's fat, but they just need some skin tightening.
Yeah.
Yeah. And that's what we're seeing with a lot with these GLP-1 patients. They have lost a tremendous amount of fat, weight, and now their skin's sagging. So they come to us for, improving the skin quality by using technology to tighten the skin and induce collagen synthesis.
Yeah, I think expectations are incredibly important to set beforehand because you're spending so much money on those. And, there's a lot of shady practices out there. And, just do this, it works. And, and like Crystal said, I mean, they'll kind of make you believe, the pictures are a little different. Each the shadowing, the light, they kind of, I don't know.
You just need another one. You just need 2 more.
Yeah.
Okay, maybe
Here's my
one more.
wallet.
Yeah.
Another cool technology and concept is the electromagnetic radiation for muscle contraction and toning, as well as fat loss. So M-Sculpt is, the name of that device. And, I think patients were really excited about it because, hey, I can get muscle toning and strengthening without having to do any exercise. I just, get hooked up to this machine and simultaneously lose fat. So I don't think it's really played out that way in, the real world. I think patients were disappointed. But I think clever marketing. But
It's like that shake weight. Do you guys remember the shake weight where
Oh,
you just you just like hold it and it's like doing the work for you?
what
and
about those those
belt.
ab machines with
Yeah.
belts, and then they give you like a little
To be
shot?
honest, that's how the EM Sculpt is. Very similar to that. But
It's so frustrating. I just think everybody in America is just so lazy. Like, just
You
work
tell 'em
out.
that.
It's
America's
so-
gonna come for
I
you.
know. It's so frustrating though, because yes, we have all these great technologies and everything, and I mean, it might get you a little bit of a sculpt, but it's not that hard to work out.
I'll counter you, Heather, and I'll say, I'll play devil's advocate.
Yeah.
I think for a lot of people too, I think time is hard. I think people are trying to find shortcuts, people who maybe have kids, people who work long hours. And so I think,
But if you're also spending the time doing this,
well, maybe they're doing the shake weight, while they're
while they're walking their kid
at work,
at the playground.
I agree. Everyone's looking for a fast solution.
quick fix.
And unfortunately, there's really nothing besides doing hard work.
Yeah.
Tried and true.
Yeah.
and sometimes the people that are offering these services aren't even qualified or know what they're doing. I've personally been somewhere where they've done so and burned people because they didn't put enough lubricant on there, and
And people think that these are, risk-free, non-invasive procedures, but things can go wrong with any procedure.
Yeah.
Yeah, I had a rash after my CoolSculpting. Like I had like a Hy-Vee kind of like reaction. That it only lasted a day or two, but even then they're like, what do we do? I'm like, I'm just gonna throw some steroid on.
I actually scabbed up. I got burnt.
Yeah, I've
on
heard
my
that
abdomen.
too. Yeah.
Yeah. There are some lawsuits too. Yeah, it's crazy.
I do. We used to use Thermage, which is the ultrasound therapy, but we used it more for skin tightening rather than like a true fat loss. And it had some okay responses, but the pain. We would give people like a Percocet before they did it, or like a Ativan. Yeah.
Which you feel is more painful, that or the CoolSculpt?
I've never had Thermage,
Oh, you haven't.
but from every person I've ever talked to that's done it,
That's
they
more
say it
painful?
hurts. Yeah, they say it
wow.
hurts. So I don't know, and it's different because I guess mostly you're treating the face.
All therapy is also kind of like that too. It's
Yeah.
kind of cool.
Yeah.
So I guess the consensus is that these fat loss treatments really don't work. These devices aren't as effective as they claim to be, and you'd be better off saving your money, maybe hitting the gym. But the other alternative is an invasive procedure, tumescent liposuction. So let's get into that. So tumescent liposuction is considered the gold standard for body contouring. It's been around for decades. And interestingly, a dermatologist, Jeffrey Klein, had introduced tumescent liposuction, which made it a lot more comfortable and safer for patients. So what it is we use a dilute anesthetic that we inject into the skin, and that helps to not only numb the area, but it also kind of separates the layers of the skin and the fat so that it's easier for us to remove fat in an effective manner. There's different flavors of liposuction. There's traditional liposuction. There is power-assisted liposuction. There is laser-assisted liposuction. And some are paired with radiofrequency energy. So there are a variety of different options available, but the concept is the same. We're targeting areas of fat, and we're literally going to town and removing large quantities of fat.
Yeah, the nice thing is definitely, I think, more noticeable results. Obviously, of course, there is going to be a longer recovery because it is invasive. And with that comes its own risk, just like any invasive procedure, risk of infection, risk of, adverse events, I guess. But that's why, of course, you want to go to someone who knows what they're doing.
Yeah, more successful results, but also faster results too, I think.
Yeah.
But you do have to realize, like, it's not, complication free. There's a lot of bruising involved. There is some discomfort after. There's a lot of swelling. And you do have to be compliant after the procedure. You have to wear those compression garments. That is huge. Patients hate it. But it is a must for getting like a really smooth contours afterwards. You don't want to be lumpy bumpy afterwards. And, just making sure that you're also staying consistent with a well-balanced diet and you're exercising, things like that.
Yeah, I had a patient that she had gotten it done about 3 separate times, and it's because she just thinks it's like a quick fix and it'll remain that way and doesn't change her eating habits, so the weight just comes back on rather quickly.
Yeah. I think what's been really trending in the media is like that 3D liposculpture, the Vaser, getting those really high definition, results, and like the etching. And I feel like although they look great, like immediately after, like for a year or two, they're kind of etching the subcutaneous tissue, so that's leaving pockets of fat. So you kind of
That
see
look
them
like
pressure
abs?
Yeah.
Oh, they said
What?
Drake got
Yeah.
that.
Yeah.
They accused Drake of getting that.
I'm not
I mean, it
surprised.
looks.
I believe
It looks like abs.
nice, yeah.
Let's get
It
a
does
photo.
look nice.
No,
but
pull
what
up
happens
Drake's
later
Instagram.
on? What happens later on when you gain weight and you're aging and your skin's also not the same? Like, it's gonna be all funky.
Oh my
I'm legit gonna get a
gosh.
cease and desist. But it's true. I mean, it's true. And like, I think more and more men are doing this. I mean, women have been doing this for a long time, just all of the body contouring. But I think, as more men are doing this, they've kind of catered these treatments more towards them. And it does make you think
And like
about
bodybuilders.
Yeah, the
and
body. Yeah.
things like that.
Interesting.
I do feel like in some instances, it's like the last result. Like they'll exercise and they'll have a good diet and just they can't get rid of that fat.
Yeah.
Yeah. No, I'm not hating on it. I think liposuction is a phenomenal procedure. It can transform lives. In the right hands, you can get beautiful results. But, some of the trends that we're seeing now, I mean, I just don't know what these people are going to look like in 5-10 years. Also like leaving areas of fat just for the illusion of having high definition. But
And the dad bod is in.
seriously,
I love a dad bod.
tell that to Dr. Amna.
Yeah, it's I don't know. I will like never want to be like the first one that tries anything. It's like I don't know, it's so risky. You see some of these complications and
Yeah.
Well, I mean, liposuction has been around for decades.
I would do
and-
lipo in a heartbeat.
Yeah.
But I don't need all the
The other
fake abs,
Yeah.
Just get it out. Like
And then, like other complications you can get, like you can be too aggressive with your lipo and lose fat. And it looks really weird. You almost get
Like
like the
concave.
skeletonization and like it's like rippled and weird.
Oh.
Because like,
it's kind of like an arm workout, right? When you're I don't know if any like I've watched videos of the lipo, and I think
it is.
before I ever saw the videos, I had this like image in my head, and then I was like, "Oh my god, I don't."
Oh, I would. When I was in fellowship and in practice, like when I was doing those cases, like I was like literally dying. Like my arms were like literally. It is a workout.
Yeah.
Because
Wow.
you're going back and forth
Yeah.
and moving in different, vectors, and we have to just keep going until we get enough of the fat and making sure that it's all even. And it is a workout. Like
Yeah.
you definitely have to be in shape to be.
Yeah, you don't want a fat surgeon who doesn't work out, he gives up halfway through.
Yeah.
Wouldn't that be ironic? A fat surgeon.
Yeah.
Would, yeah.
Could you use liposuction to, like, if somebody wanted, like, wider hips, if they
Like, you need
have,
fat.
if
Yeah,
the
fat
fat
transfer.
there,
Yeah.
yeah.
So
And
basically,
just-
what you can do is with the fat that you're taking out with liposuction, you essentially like filter it and process it so that it's actually an injectable that you can transfer and inject into other areas. So you can do it in the face, you can do it in the buttock area, you can do it in the hips, some people are doing the breasts. So
Yeah.
this is a way that you can actually use what you're actually sucking out and repurpose it.
I've seen fat transfers for like under eyes. But I know that if it's placed too superficially, you can really tell.
Yeah.
Can it move? Like if you were to do it in the hips, is there a possibility it could?
I think
Become
there's a possibility,
asymmetrical?
but the thing that I've seen with other patients who've had fat transfer is that you're transferring a biological tissue and it has metabolism, right, in a different area. So it's not necessarily going to behave the same way in other areas. And I had
Right.
this one lady who got fat transfer from over the seas, and she started developing these inflammatory nodules wherever it was injected. So she looked awful, and she had that for months and months and months, and you couldn't do anything about it because it's in her skin now. So, and it was just kind of, behaving differently than other places she had it injected.
Right.
Is that kind of like, so I've seen some women that they have really nice buns after getting liposuction and the
That is what
fat
they're
transfer.
using
But
for
then
that
I've also
BBL.
seen,
BBL,
but
baby.
then I've also seen those that their butt looks so lumpy.
Yes,
like
that's
and
also
like
part of it.
like it looks like their entire butt is just covered in cellulite.
Yeah.
Yeah. So, I mean, I think that if they had like fat transfer to the buttock area, like it certainly can be uneven.
Okay. Is it a depth thing too?
I think so. Yeah. I think depth, surgical technique, also the inherent biological like characteristics of the fat, and it may not be even on one side versus the other. So I'm always a little wary about it, but I mean, I like the idea you're using your own fat,
Right.
Yeah.
and it's natural.
Yeah. How long is a procedure typically for liposuction?
It depends on the area, right? So we're using liposuction in a variety of different areas. So it could be, an area like small, like the submental area under, the chin, the double chin, or large areas like abdomen, thighs, buttock area. So it really depends on how big the case is.
And there's also ideal candidates for lipo as well, which I think is worth mentioning. I think, you're not going to take a case where someone is like obese. You obviously want to get down to a reasonable weight because that itself will hold its own complications.
Yeah. And I think there's a role like for, morbidly obese patients to seek some intervention, either like doing like bariatric surgery or, going on those GLP-1s, losing enough weight where, it's still sustainable for them. But if they need a little help, I mean, I think that's where liposuction comes in.
Yeah.
Any other questions or thoughts on lipo?
It's definitely more, adherence. Patients really need to adhere more to that procedure. But obviously, I think the results are phenomenal when done correctly and when, patients are able to stick to their part of the, treatment.
Yeah, and like the commitment to recovery and just knowing, especially with liposuction, there's going to be more downtime, more healing process. So it kind of depends on how much you're willing to take off work or your daily life to
Or
heal.
go to work looking crazy.
Yeah.
All right, so body contouring definitely is a hot topic in cosmetic dermatology. It is an option that people can definitely look into, but remember, seeking the advice of a cosmetic physician who is well versed in this can give you the best guidance. Like we had all discussed, I don't think like the non-invasive procedures really help most patients, so I'd be wary about those kind of treatments. I do think that there is a role for liposuction in good candidates, but nothing really beats having a healthy lifestyle. And there is no substitute for good old exercise, good nutrition, and we'll talk about that in our next episode, how a healthy lifestyle can influence our skin. But I think that wraps up our episode. Hopefully you enjoyed our discussion. Please like, follow, leave us a review. But until next time, SkinSide
Out.
Thanks for listening. This episode of SkinSide Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.